While ginger is generally safe for most people, there are some individuals who should avoid or limit their intake of ginger. These include people taking blood thinning medications. Ginger has anti-platelet properties, which means that it can thin the blood and increase the risk of bleeding. People taking blood thinning medications, such as warfarin, heparin, or aspirin, should avoid consuming large amounts of ginger or taking ginger supplements, as it can increase the risk of bleeding. People with gallstones, ginger can increase the production of bile, which may worsen symptoms in people with gallstones. It is important for individuals with gallstones to speak with their healthcare provider before consuming ginger. People with history of bleeding disorders, ginger can increase the risk of bleeding, especially in people with a history of bleeding disorders such as hemophilia. These individuals should avoid or limit the intake of ginger. People with low blood pressure, ginger can lower blood pressure, which can be beneficial for some individuals. However, people with already low blood pressure should be cautious when consuming ginger, as it can cause blood pressure to drop too low. People with history of allergic reactions to ginger. Some people may be allergic to ginger and may experience symptoms such as rash, hives, or difficulty breathing. These individuals should avoid consuming ginger. People with diabetes. Ginger can lower blood sugar levels, which can be beneficial for people with diabetes. However, individuals with diabetes should monitor their blood sugar levels closely when consuming ginger, as it can interact with diabetes medications and cause blood sugar levels to drop too low. People undergoing surgery. As mentioned earlier, ginger can increase the risk of bleeding. It is recommended to stop consuming ginger at least 2 weeks before undergoing surgery to avoid any potential bleeding complications. Children. Ginger is generally considered safe for children when consumed in small amounts as a part of a balanced diet. High doses of ginger or ginger supplements should be avoided in children, as there is not enough research on its safety and effectiveness in this population. People with digestive issues. While ginger is known to have digestive benefits, it can also worsen certain digestive conditions such as GERD or stomach ulcers. People with hormone-sensitive conditions. Ginger has estrogen-like effects and may interfere with medications used to treat hormone-sensitive conditions such as breast cancer, uterine fibroids, or endometriosis. People on certain medications. Ginger can interact with certain medications, including blood thinners, diabetes medications, and high blood pressure medications. Pregnant women. Ginger has been traditionally used to alleviate nausea and vomiting during pregnancy. However, pregnant women should exercise caution when consuming ginger, especially in large amounts or in supplement form. Some studies have suggested that high doses of ginger may increase the risk of miscarriage or harm fetal development. Pregnant women should consult with their healthcare provider before consuming ginger to ensure its safety for them and their baby. Breastfeeding women. There is not enough research on the safety of ginger for breastfeeding women. It is recommended to consult with your healthcare provider before consuming ginger while breastfeeding. People with heart conditions. Ginger can lower blood pressure and heart rate, which can be beneficial for some individuals with heart conditions. However, it is important for people with heart conditions to speak with their healthcare provider before consuming ginger, as it can interact with certain medications used to treat heart conditions. People with liver conditions. Ginger has been shown to have hepatoprotective effect, which means it may protect the liver from damage. However, individuals with liver conditions should speak with their healthcare provider before consuming ginger, as it can interact with certain medications used to treat liver conditions. People with kidney disease. Ginger contains oxalates, which can contribute to the formation of kidney stones in people with a history of kidney disease. Individuals with kidney disease should speak with a healthcare provider before consuming ginger to ensure its safety for them. People with Parkinson's disease. Ginger can interfere with medications used to treat Parkinson's disease and may worsen symptoms. People with a history of seizures. Ginger can lower the seizure threshold and may increase the risk of seizures in people with a history of seizures or epilepsy. People with mental health conditions. Ginger can interact with certain medications used to treat mental health conditions such as depression and anxiety. People with autoimmune disorders. Ginger can stimulate the immune system, which can worsen symptoms in people with autoimmune disorders such as lupus or rheumatoid arthritis. It is recommended to speak with your healthcare provider before consuming ginger if you have an autoimmune disorder. In summary, while ginger is generally considered safe and beneficial for most people, there are certain groups which should be cautious or avoid consuming ginger altogether. To know more about the benefits of ginger, there is a link to this video at the comment section. Always consult with your healthcare provider before consuming ginger or ginger supplements if you have any medical conditions or concerns.